guys, and welcome back to the Nurse Nook. If you're new here, welcome. My name is Alexis Nicole and I make videos all about nursing, lifestyle, and wellness. As you can tell by the title of this video, this is going to be a grad school update. I currently am a NICU level 4 registered nurse, but I'm also in grad school to become a neonatal nurse practitioner. I recently, and when I say recently, I mean literally yesterday, I recently just completed my 5th out of 7 total semesters in the program. I've been giving updates about my progress throughout the program, but this one's gonna be a little bit different because this is my first semester of actually having clinical in person. And so my experience this semester has been totally different than the rest of the program. So I have a totally different viewpoint to share with you guys. Before I get into the video, I just want to say thank you to our sponsor, Picmonic. If you know me, you know I absolutely love their company. I highly recommend them to all nursing students, all healthcare professional students, and honestly, even professionals that are working in the field. It's a great way to freshen up on your anatomy, your physiology. I personally love their company because I am a visual learner, and Picmonic is a online-based learning tool to help people with different learning styles really grasp the information. They take really difficult concepts and they break it down in very easy to learn ways. I love that they use characters, they use storylines, they use a lot of different colors, they use a lot of layman's terms. Makes the learning a lot better. For me, I need things to be broken down like microscopically to very easy to digest pieces, and I feel like Picmonic does an absolutely fabulous job of that. So whether you're in school right now, whether you're struggling to learn your concepts in anatomy, whether you're already a healthcare professional, wherever you are in your journey, I feel like Picmonic is a great resource to anyone just looking to improve their learning in healthcare fields. If you're interested in trying it out, you can click my link down below for 20% off. Okay, so let's get into the update. You guys, I am struggling. Well, I'm good now because now that I finished my semester, I literally have like a week and a half off of free time before I start again. So I'm okay now, but you guys, I was struggling this semester. If you are not already following my Instagram, I'm gonna leave it here. Go check it out. I post updates there almost daily. I shared a post a month or two ago about my experience so far in this semester, and I was very transparent, very honest with you guys that I was having a tough time transitioning. The biggest hurdle for me this semester has been the confidence level. Y'all, I have been a nurse for over 6 years now. I feel pretty confident in my field. I know what to do. I'm like boom 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 boom. Let me tell you, for me personally, that confidence does not translate because guess what? Once you're in the provider role, you are in a totally different experience, and it is nothing like nursing. And so in clinical, a lot is expected of you. And that's one thing that I will say has been so different from nursing school. I feel like clinical and nursing school, not much is expected of you. A lot of it for me personally was like shadowing. You know, you'd get vital signs, you'd do a head-to-toe assessment, you'd pass meds every now and then, but everyone knows you're a student. Sometimes the nurse, you know, was busy and just doing her thing and you didn't really get to do a lot, and you would just kind of like look over their shoulders and kind of watch what the nurse is doing. In the NP role and as an NP student, it has been totally different. People expect a lot more out of you and you're expected to do a lot more in the clinical setting. Like for example, in the mornings, I present my patients during rounds. And even that, it's nothing like too serious or scary, but I'm like, do you really trust me to like present this patient and like present the plan of care and what I want to do? For me, that was a huge like shock because I feel like I'm still a student, I'm still learning, and I don't feel confident at all in my decision making. This is my first clinical experience, so I think I know what we want to do for this patient, but then I'm like, I don't know, maybe I'm missing something. And so my confidence was like kind of in the toilet. And it was just a very like humbling experience. Like I said earlier, being proficient and confident in your role and then completely changing to a new role and now having to learn how to be confident and competent in that role has been a very humbling experience for me. It's not like I just go to clinicals and just kind of watch them do their thing. Like I'm in there, like I'm the head of the bed at deliveries, like I'm doing stuff, I'm intubating, I'm throwing in lines, I'm giving the nurses orders. And mind you, my preceptor is there at all times, but it's still like, it's nerve-wracking when you're the one that's like making these decisions and calling things out and people are looking to you for your plan. So yeah, it has definitely been a struggle for me. I would be lying if I said like, school's just great. Like everything has been great, because this semester has been whooping my ass, you guys. It's whooped my ass because not only are we doing clinicals this semester, and I will tell you, we had 180 clinical hours to complete this semester, which ends up being 15 clinical days. And for me personally, it took me a while to get my approval from the hospital that I did my clinicals at. So it took me a little bit later in the semester to start my clinicals. So I kind of had to like stack them all together, which was, not the best. But I will say I'm part-time currently, and I've been part-time throughout this entire program, part-time as a bedside nurse. And I don't know how people do it working full-time. Majority of my classmates are part-time, if working at all. Some don't even work, which like God bless them. Love that for them. Even like being part-time, at some weeks it was like oof. Like there was some weeks, like 1 or 2, that I was working 5 shifts a week on top of like having to study, on top of having assignments. And so that was like really kind of alarming. My free time this semester was like slim to none. I didn't see my friends a whole lot. My time at home with my fiance was definitely diminished significantly. And just like time to be myself. I mean, I've been gone off of YouTube for like 2 months. I haven't made a video. Also because I lost access to my YouTube channel. But it kind of worked out because I'm like, I probably wouldn't have been making videos anyways, because I have been stressy those. So not only were the clinicals kind of stressful for me, but also this semester we started doing case studies. And when I tell you guys, these case studies have been a monster. It's literally like care plans in nursing school on crack. Like instead of just doing like your nursing diagnosis, you're actually like doing medical diagnoses, supporting each diagnosis, why you think it's this, how you're going to treat it, step by step, every single order that you're going to put in, a reference for that order you put in, your differential diagnosis, what's the medical management, what are you going to put in your TPN. And my case studies would be like 25 to 30 pages. I had 3 of those on top of clinicals, on top of 4 exams, on top of weekly discussion boards, on top of weekly meetings, on top of work. Like it was a lot to handle this semester. And again, like I said, having my confidence tested in the clinical setting kind of poured into other areas of the program for me. So I started questioning myself more on these case studies, on my exams, like studying. I was not doing the best with affirming myself positively. I was having a lot of negative self-talk. I realized of, oh, I didn't know this, like you should have known that, like why didn't you know this? And I had to like catch myself and kind of reorient myself. And I will be honest with you, it is hard to, for me personally, it is hard to affirm myself in these situations where I'm in clinical and I feel like, I said the wrong thing, or, I didn't catch something in the order set or whatever it is. And I have to remember to give myself freaking grace. I literally have like 2 people in my head, like talking back to each other. Like on one side, I'm like, give yourself grace, girl. You're just a student. This is your first semester. You have never been in this role before. You are brand new. You are doing the best you can. Your preceptors have nothing but good things to say about you. And on the other hand, I'm like, girl, you should know everything. Why didn't you know that? Like, I'm trying to listen more to the more positive voice, but like every now and then, negative self-talk definitely jumps out. And honestly, something that was kind of bothering me this semester was the comparison to my peers. And again, this is one of those things where I know it's not the right thing to do. Everyone is in their own journey. Everyone has their own path of learning. Everyone learns differently, but I caught myself again, because my confidence was being tested in the clinical setting. I feel like I was questioning myself in every other aspect. And so we've had on-campus days where we've had simulations, lecture, so like in person with your classmates, with the professor. And I've caught myself, like a student will say something and I'm like, oh my gosh, why don't you know that? Like you should know that by now. I know that is so unhealthy of myself, and if anyone else were to say this to me, I'd be like, girl, you are doing your freaking best. Don't compare yourself to anybody. Everyone is on a different path. You are doing your best. But for some reason, I'm like allowing myself to think this, and it's just not aligning with who I am as a person and what I believe. So I'm just trying to rebuke those thoughts of comparison and that negative self-talk, because I don't identify with that and that's not me. But I love making these videos to share with you guys. A lot of this stuff is realistic. You know, I love to be honest and upfront with you guys and just share my experience. So if anyone else is going through this process or interested in trying grad school, becoming a provider, this is all very normal. These feelings are all very normal. And you know, it's not reality to just be all excited about school all the time. Be like, oh my God, I'm just so happy I get to be in this program. Like everything is great. And I do feel like that every day. I'm thankful that God brought me here and thinks I'm smart enough to accomplish this. And one of the mantras I keep repeating to myself over and over again is God would not have laid this on my heart. He would not have brought me this far if I wasn't able to do this. So I just need to trust that I can do this. It is within me. I have the knowledge. I have the capabilities to get through this program and do well and become a great provider. But you know, sometimes it's hard. The days are very long. I try to be someone that like lives in the moment and like takes every day for what it is and just like cherish every day, every hour. But y'all, in this program, I have literally been, I said to my fiance Alvin, I'm like, you know what I wish I had? I wish I had that remote from the movie Click where he just like fast forwarded things that he didn't want to experience. I wish I had that freaking remote right now, because I am so excited to be done with this program, you guys. I'm grateful for all the learning opportunities I'm getting. I'm learning so much. But to be honest, I am very uncomfortable, and I know that is what I need to feel to be able to grow. Growth doesn't come from comfortability, but it is very uncomfortable. That is a great way to describe it. Being in clinical is uncomfortable. Learning these new procedures, intubating, putting in lines, umbilical lines, arterial lines, it is very uncomfortable, and the discomfort is pretty constant. And I just, you know, I really look forward to going to work these days, because at work I am so comfortable because I know what to do. It's like clockwork. I'm just like boom, boom, boom. Admission, I know what to do, I know what to do. When I'm in the clinical setting, I'm like, oh, I don't really know, like what would you do from here? And so it's just a lot of discomfort, and I really just have to lean into that discomfort and just know that it's not going to be forever. I will say this is the first semester that I've like questioned my decision starting this program. I used to be very like gung-ho, absolutely, this is what I want to do, this is what I want to do. And I still feel that way, don't get me wrong. But I've been very tested this semester, and I'm like, am I sure? Like, am I sure? And I know that I'm sure, but sometimes you experience things and I'm like, oof, like, are we sure? Are we sure? I don't regret my decision at all, but this semester has just definitely been a test to my grit. One of my friends actually sent me this podcast by Mel Robbins on confidence, and since listening to that podcast, things have gotten so much better for me. I'll try to link it down below for you guys. But just really affirming myself has been the best way I found to really push through these hard times and these hard feelings. Yeah, that is my update for this semester, you guys. Not super positive, but it is what it is. I'm being real with you guys. I am still very happy that I'm in this program. Thank you, Lord, for bringing me here. I cannot wait to be a provider. I'm so excited. But you know, a lot of discomfort comes with it, and that is okay. That is how we grow. We need to go through these hard times to be able to be on the other side and be a good provider and take care of our babies as best as we can. And thank you guys so much for watching, and I will see you in the next video.